Man recovered from coronavirus after a long stay in the hospital.
He is the first patient speaking out about receiving convalescent plasma since the FDA has halted the emergency use of it. Health reporter Haley Hernandez is joining us now. And Haley, isn't this new ruling bad for patients like the one you spoke to?
Yeah, Christine, you're right. It probably is bad news for them, but it is not permanent. The FDA says they are just waiting on more data on whether or not this treatment actually works. And the patient that I spoke to says he's proof that it does. He was one step away from a ventilator. Phil Taus would have looked like one of these patients, struggling to survive because he was.
I was really blessed, really blessed.
But here he is today, so happy and healthy, it's almost hard to believe the turnaround he made.
They proceeded to tell me that I had double pneumonia. Double pneumonia.
He knew he had COVID-19 and his wife monitored symptoms from home. When his oxygen plummeted to the danger zone, she drove him to the hospital without knowing if she'd ever see him again.
It's very, very difficult to drive your loved one to the ER and walk out and leave them there. Our daughter was waiting in the parking lot.
What can we do? Yeah. Then doctors called with a tough question. Would she allow them to use an experimental therapy using antibodies from survivors' blood to treat her husband? She quickly learned to be a candidate to receive this plasma meant things weren't headed in a good direction.
They didn't know for sure that it was going to work, but, it was something that was available to help.
Here, Dr. Jim Musser with Houston Methodist explains what they learned.
There's clearly a good signal of decreased mortality in patients who are given this important therapy.
But it's a therapy that's on pause until the FDA can approve an expansion of their study. And Dr. Musser hopes that will come sooner than later. None of them know if the plasma saved Phil's life, but his family is sure thankful.
Would he have gone on a ventilator? Would he have not come home? So we have to think that those antibodies, helped so much.
Hey, I'm back working, been working a month and a half now. I'm lifting weights. I'm very thankful.
And now Phil is in a position where he can now donate plasma himself. And actually, the Gulf Coast Regional Blood Center is so desperate to find antibodies in survivors' blood that they say that they will screen every single blood donation for antibodies, which means if you're even curious if you've had the virus, you can donate blood and really kind of get an antibody test for free. They say that if you have the antibodies, then they'll call you back and request that you donate plasma. Keith?
So, Haley, is that still happening even with the FDA putting the use of plasma on hold?
Really good question, because I did ask Methodist and the Gulf Coast Regional Blood Center about that today. Both say they are still in need of donors and accepting those donations because they really don't anticipate this FDA hold to be that long. Because really the FDA, what they're doing right now is just moving cautiously. They're not saying that plasma is not safe. They're just saying that they want more data to determine if it's effective, to determine if it's the plasma that's actually helping these patients recover.
Okay. All right. Thank you for clearing that up. Haley Hernandez, thanks so much.
Yeah, we certainly appreciate that, Haley. Thank you.